We are live. We are live. Hello, everyone. Hello, everybody to YouTube and follow us on Facebook. Please meet Alan. And Dr. Wong is joining us today via phone. And Dr. Wong, good morning to you. Good morning to you, Alan.
Hey, good morning, everyone.
All right, all right. There we go. We got an image. We got it set. I'm getting ready to roll. Definitely. Let's get this over. So first of all, Alan, thank you so much. So,
thanks for having me. I'm excited about this.
oh, I'm excited. I'm excited to have you, brother. So listen. So we're gonna start out with a few things because I know Dr. Wong's got a little time, and she has patients waiting. So first, we're gonna discuss what do you actually do.
Yeah, man. So I work for Avexius Health Solutions. We are a company that really helps providers like Dr. Wong bring on therapies that really just take a comprehensive approach to health and wellness, right? And really get to the root cause of medicine. So a lot of that revolves around hormone optimization, we get into peptides and weight loss, nutrient deficiencies and things like that. But we want to look at the body, work it from the ground up. Like I said, really just get to that root cause medicine and figure out how to fix those symptoms and truly help people. So we get to work with Dr. Wong and implement those therapies into the clinics to help all her patients.
I freaking love it. I love it. So when you talk about things like that, so one of my questions is, especially you, Dr. Wong, what made you switch into this to reach out to Alan, and how did you get in contact with Alan? I know we have a few things that you wanted to discuss, so I'd like to get you on, and then me and Alan could come in to some of my other questions. I know I provided you with some questions. Would you like to answer some of them?
Absolutely. And I apologize ahead of time if I have clients coming in, but I would love to speak more if I have a chance later.
Okay, absolutely. So go ahead and tell me what 955 Main Street offers in the relationships that you've developed with Alan and his corporation and company with Avexipel.
So I would like to say, Alan, it has been life-changing ever since I met you and I joined the Avexius team. So I've been a family physician for over 20 years. And for those of you who don't know, there's a joke, family physicians take care of everybody from the cradle to the grave, from the womb to the tomb. I see all patients, all ages, men, women, take care of all disease states, blood pressure, cholesterol, diabetes. And there's a wealth of things that I can manage. But I have to say that over my 20 years, there have been some symptoms that have challenged me as a physician where I just always felt like I could never really quite give my patients the answer and help that they needed. And I'm going to get a little bit more specific. So some of those symptoms are like when people men and women hit their 40s and they say, oh, I just kind of have some physical and mental exhaustion, decreased libido, brain fog. And before Avexipel and before meeting Alan, I would just say, well, let's run some blood panels. Let's do a CBC, thyroid, B12. And I felt like I was grasping at straws, and I felt like I never had a great solution. And I'm going to be honest. I'm going to tell you a little secret. I'm in my 50s now. So starting a few years ago, I started to feel a little tired. I have about 3,000 patients in my medical panel, and I have a med spa, and I run my business. And I'm not going to lie, it's a lot. So I started to experience some of these symptoms that my patients were talking about, some mental, physical fatigue. And I was like, there has to be a better answer. So actually through my med spa part of the office, I learned about hormone replacement therapy and pellets. And I got some placed myself. And this has been life-changing. And I was so excited. I wanted to share this experience with my patients. And it has been so fulfilling. I've been doing pellets for over a year, and the response I've gotten is just phenomenal. Patients come back and they say that I've given them their life back. And I finally feel like I have an answer to these symptoms that I was never really able to completely help them with. And so this has been really a satisfying addition to my practice.
No, I love hearing that. I mean, and that's powerful, right? I mean, you knew that there was a missing piece to this, and there were so many patients that you wanted to help, but you didn't have the tools at the time. and now you do, right? And you're able to implement that. And really, I mean, talk about a life-changing therapy. I mean, saving lives, saving marriages. We get to hear the stories day in and day out, and that's why I love that we get to do this. I mean, the passion behind it. I mean, it's fun.
So one of my questions to both of you is, what are the common symptoms? Because I heard she was talking about what type of imbalancement does someone have? Like, is it like physical or is it mentally? Because I've heard Dr. Wong make a statement, and then I've heard you guys, discussing it. But what are the imbalancement of the hormones or the system? Like, what is it that they're feeling?
Yeah, I mean, it's a little bit of both, and it's going to be different with every patient. I mean, normally when you think about hormone deficiencies, everyone thinks about menopausal women and estrogen imbalances, right? Hot flashes, moodiness, night sweats, but it's so much more than that, and even at younger ages. So, I mean, things like anxiety, depression, trouble sleeping. I mean, brain fog. You ever feel like you're trying to get a word out, but it's like pushing a thought through Jello, right? You just can't
Yeah,
find that word.
yeah.
Things like that, and obviously recovery, performance in the gym, whatnot. Chronic pain, huge one, big indicator of low testosterone for men and women.
So when you're
So
discussing that and you're saying that, like, also for you, Dr. Wong, so you're saying it's test that repairs it, or is it a progesterone, an estradiol? Like, do you guys have a specific way of detailing this? You can't, someone comes in and writes on a piece of paper, this is how I feel.
Yep.
But do you just give it to them based on that?
No.
Or is it like, do you do some type of test?
Yeah, no, it's all individualized to each patient. So it's going to start with those symptoms and how they're feeling, right? That's what we want to treat. But we got to run labs on it. So we have comprehensive lab panels where we're really going to take a deeper dive into everything that's going on. And it's not just addressing the hormones either. I mean, like I said, we really want to take a well-balanced approach to this, like integrative. So we're looking at gut health and inflammation. Do we have vitamin and nutrient deficiencies? We got to tie it all in together. So we could balance hormones, but if you got these other issues going on, it's hard to, make them effective and optimize them.
So, Dr. Wong, this one's to you. So, from what Alan's just telling us, he's got a whole little venue and a little test kit thing that he does. So, I come in and I'm interested in doing a hormonal treatment. What's the first thing that your practice offers me?
So it's a whole process. So we, like Alan said, we're going to do blood work. We're going to go see your levels, and then we take a comprehensive medical history, see what kind of medications you're on, and also a symptom sheet. We have a symptom sheet separate for men and women. And then also if they want to share anything, but the symptom sheet has questions about like mental, physical exhaustion, libido, for women, vaginal dryness. We really, that's super important. People forget how like tired or how bad they felt until they start doing the hormone replacement. When I show them these symptom sheets, looking back like 3 months before, they're like, oh my gosh, I can't believe I felt like that, because they feel so amazing when they come in. So anyway, back to what you were asking. So we do blood work and the symptoms, and based on their medical history. So as Alan was saying, we custom tailor the treatment plan based on what their history and lab results show.
Okay. All right. So, I found it interesting. So, when you were speaking, and also to you, Dr. Wong, there was one thing I was always trying to figure out. While the focus is on estradiol and testosterone, how do other hormones like progesterones and thyroid hormones fit into the comprehensive type of treatment? So I was kind of just trying to figure it out. Like, how do you figure all that stuff out from lab work, and like what, make a determination of what's a normal like height for a guy to be at with a blood work, and a woman to make that decisive decision?
As far as like lab levels and things like that.
Yeah.
So, I mean, when we look at it, I mean, you look at those reference ranges, and I don't want to get, too geeked out on the science. Dr. Wong can kind of get into a little bit more, but those reference ranges are varying, right? They're pretty wide.
Yeah.
So, I mean, we want to make sure that, normal is not always optimal. And that's what happens with patients. They go and see their providers and they complain about these symptoms. Like, well, guess what? We ran your test and you're in the normal range. There's nothing we could do for you.
Yeah.
Well, I mean, that's a little backwards way of thinking about it, right? If they have symptoms, there's obviously something going on there. So we want to address that and like really just get them to the optimized side. When you bring in things like progesterone, there's little nuances that's going to be more for women when it comes to that. But it really just depends, like I said, what's going on with their symptoms, how are they feeling? Progesterone is really going to be really tied to estradiol more for your postmenopausal women, but it's going to also play a role in your younger women as well, as far as maybe they have cyclical migraines. Progesterone can really help with things like that. It really helps promote better sleep.
See, I didn't know that. So, Dr. Wong, do you believe that because I always hear things about migraines. A lot of people are having migraines. So you're basically saying that progesterone is a great,
It can for women. I mean, it might not be the only answer, but I could
yeah.
speak to my wife for that. I mean, and I noticed it a little early on getting into this where she had a migraine every month. And I'm starting to think back. I'm like, hey, let's start timing this and see when it is. And sure enough, it's right before she's getting ready to have her cycle. She gets these bad migraines.
Huh.
So we started her on 100 milligrams of progesterone just the last 2 weeks of her cycle, and it's completely gotten rid of it. Now, there could be other things going on, obviously, but just looking at little things like that can make a big difference.
So Dr. Wong, same question to you. How would you make that determination? Now I've walked into your practice, you have my lab work. How do you talk me into either picking a progesterone, a thyroid, a testosterone pellet treatment? Like, how do you make that decisive decision?
Before I answer that, I just want to and continue what Alan was saying about the benefits of progesterone.
Absolutely.
Until I started doing hormone replacement therapy, I never realized the power of progesterone. So I'm just going to also backtrack. So starting around our 40s, women start to make less progesterone because your body just thinks it doesn't need it anymore for reproductive purposes. But progesterone is such a beneficial hormone in so many levels. It's a calming drug. That's why we have to prescribe it at bedtime. I have women take it an hour before bed, and they say they have the best sleep that they've ever had. I've been able to get women off of their anti-anxiety, antidepressant medications because it carries over throughout the day. They feel less stressed. So progesterone is a very often forgotten about hormone that is completely safe and necessary. So I do love progesterone. But getting back to your answer, so yeah, we do a whole blood panel that includes the hormones, estradiol, testosterone, thyroid levels, including free T3, which can be a whole nother podcast discussion, iodine, vitamin D, B12, and Avexius. Some genius created this dosing calculator. We plug all these levels in to the calculator with your symptoms that you've described, and we come up with suggestions on whether you need estradiol, the dose, and testosterone, progesterone. Now, that being said, like Alan was saying, the lab results are kind of a guideline, and traditional medicine has not had much experience with hormone replacement. So we use these lab levels as a guideline, but I also am very symptom driven. So I kind of step back and look at the whole picture, look at the lab results, look at the symptoms that you're talking to me about. And based on that, we'll come up with a very customized treatment plan for you. I mean, so for example, if your estradiol level is low and you're having hot flashes, you're going to need estrogen. If you have like brain fog, decreased libido, that's probably going to be testosterone. And a lot of people are still surprised to hear that women need testosterone. Yes, women need testosterone. So I'm speaking for men and women in regards to the testosterone. And then the progesterone, anytime you're on estrogen or estradiol, you absolutely need to have progesterone to balance the estradiol out, because it's all about balance, the balance of the hormones. So we start off with the lab results and your symptoms, and we come up with a customized plan. We have you come back in a few weeks, have you do another symptom sheet so that we can correlate, and we might make some adjustments based on that.
Okay. All right. So one of the main questions I have, so I have a lot of buddies of mine, obviously some ex-test users from the street, messing with that street stuff. And now they're going to H.R.T clinics and stuff like that. So what I find interesting is they use other companies, which I'm going to leave nameless. I crossed that out. So I need you to elaborate to me on the science and technology of Avexa, just due to the fact that everyone's like saying, well, this is a better product. And this one I liked because of this way. So I want you to explain, because I've seen the success with Dr. Wong's practice and the amount of people where obviously we've gone to events, we've sat with you, where she's had one or two people, and it was a hard sell in the community of Winchester and everything, just due to the fact that everyone's using this other one and they're like, oh, these are the bomb, they were out first or whatever. So what makes your product the product that stands out the most?
Yeah.
That you believe?
Yeah, no, absolutely. So first of all, let's get into the modality that we're talking about, right? Because there's a lot of modalities of hormone optimization and hormone replacement therapy. When you look at it, there's creams, there's pills, there's patches, there's injections, which a lot of your buddies were kind of messing around with, right?
Oh yeah.
But really,
And you know who you are.
Our key focus is we believe bioidentical sub-Q pellets are the best modality because it's more sustainable to the patient, better compliance. For females, they last 3 to 4 months. For males, they last 5 to 6 months. So you're not worrying about putting a cream on every day, doing an injection once or twice a week, right? It's hard to sustain that long term. So we're really focusing on trying to use bioidentical pellets. What's great about that modality is, I kind of cover some of the things, but it's also, it's true endocrine mimicry for the body, right? It's a molecule that is the same exact molecular structure that our body produces. So it's easy for them to really metabolize it. Now there's other, companies out there that make different pellets, right? Where we really have changed the game was, early on, we started to see that, we were getting great benefits from this therapy. It's like your phone's about to die there. I don't know what's going on.
It's on the back. Go ahead. I'm just getting up a second. Go ahead.
But, so where I was going with that is, there's other pellet companies out there that make similar pellets, but we realized early on that, we're starting to see some issues as we were doing this long term. Some of those issues were really around inflammation, infections, and then long-term scar tissue, which building up over time can be problematic, right? You get scar tissue. The whole point of pellets is they get into the sub-Q fat layer, they absorb into the bloodstream.
So can you stop right there for a second? Yeah. That's what I kind of wanted to touch base with also, Dr. Wong.
Yeah.
You just said the subcutaneous fat.
Yeah.
So a pellet goes into that area, not into the muscle cell.
Correct.
Now, if a male gets it, where should the placement be from the difference of a male and a female?
Yep, and that's one of the things that we changed. Historically, we've always gone into the glute, like bikini line for women, guys kind of the same area. What we found out early on was guys don't have a lot of fat down there, right? They're normally thinner. So we actually moved it up into the love handle, kind of like the flank area, right? And go right into that. Typically a little bit more fat. Even your really lean guys are going to have enough deep fat in it that we can get those pellets in.
Really?
So the whole point is getting them into that deep fat, get into the bloodstream, absorb that way.
Okay. So Dr. Wong, after Alan just said that, is there issues with guys and girls coming in and having you, in my terminology, slice them up and stick a pellet in? Can you elaborate exactly what the procedure is? Dr. Wong? I guess we might have lost her, and she went to her patients, obviously. So I guess we're gonna miss out on that part with her.
I could address that if you want. Really
quick. Absolutely.
Just because you wanted to just scared everybody when it came to therapy, right? So I promise you, it is a pain-free, bruise-free procedure. There's little to no downtime when it's done the way that we teach and train our providers to do it, and then with our pellet as well. But it's super simple. It's a 5-minute procedure in office. No sutures involved or anything. They really just clean up the area, numb it up so you don't really feel anything.
So you get Novocaine.
Right? Yeah, you're a little lidocaine mix.
Lidocaine, right? I'm sorry.
Doing a little tiny incision, and then they take a little trocar tool. It's a little, metal device that just goes right into the sub-Q fat. Like I said, don't feel a thing. It's super quick, super simple. And they just lay these little tic-tac sized pellets right down in a track, come out, put a little steri strip on top to seal that wound, pressure bandage, and you're out the door. That's it. No sutures, no stitches, nothing like that. Very little downtime. Get back to activities pretty quickly.
All right. So you're saying that basically, what's the difference between traditional methods and this type of method?
As far as using like shots or creams?
Yeah, shots and everything.
Yeah. So
hold on, Dr. Wong's calling.
She's calling back in.
But hold on. No, go ahead. I'll have her on myself.
Yeah. So and I don't want to hear you guys hear me say that these other modalities are bad, because they all play a role in every patient's. And really, I always look at, if you need hormone optimization and you're on some modality, it's better than nothing, right? But, when you go back and look at some of the creams, which a lot of people are, especially women, they get a little bit messy. Patients just don't typically absorb the creams that well, right? And then
I see you back on.
Yeah, I was taught. Oh, hi. Can you guys hear me?
Yeah, we can hear you. Hold on. Yeah, go ahead.
So I do have my first client here for pellets. How exciting.
Nice.
So I have to go soon, but I wanted to expound on what Alan was saying about vaginal creams in women.
Oh, I'm sorry. I didn't know we were talking about vaginal creams. Hold on. Let me get myself up for this one. Go ahead.
something about like that. Well, anyway, so I'm going to say, so I have women in my medical practice who come in and I take their history and I say, oh, so you're getting prescribed these vaginal creams or patches or whatever by your OBGYN. And they're like, yeah. They're like, but I don't use it. I go, why don't you use it? They're like, well, it's messy. It doesn't work. Blah, blah, blah. And then like I explain to them about pellets, about hormone replacement therapy. They switch over, and I have literally changed all these women's lives with messy creams. And it's not just about the vaginal dryness. The estradiol that they're getting helps with so many other things, the hot flashes, the bone density, like everything.
So I'm sorry, Dr. Wong. So you're telling me that hot flashes is taken care of by vaginal cream? Vaginal cream?
No, I'm saying that they were getting prescribed vaginal cream by their gynecologist to address one issue. So traditional medicine didn't have a great answer for estrogen deficiency. And back in the late 1990s and early 2000s, when I was in med school, the Women's Health Initiative scared everyone away from synthetic hormones. And so doctors normally like have been hesitant to prescribe straight out estrogen that is synthetic. So we kind of just treat the symptoms. We give something that kind of works for hot flashes, like Glacohosh or clonidine. We kind of give something that helps with sort of the vaginal dryness. There was really no great answer because everyone was afraid to prescribe synthetic estrogen. So now with pellet therapy with bioidentical hormones, estradiol, we can treat all of these symptoms because we're getting to the root cause. That's what I'm saying. So we don't have to like patchwork the treatment. We can treat it by getting to the root cause and supplementing with the estradiol. That's what I was saying. And these women love that they don't have to use these messy vaginal creams.
Okay. So I know you got to get going, but do me a favor. Feed me a success story. Tell me about one great success story that's touched your heart to stay with Avexitol.
If any of you know my esthetician, Cindy, and she is my biggest promoter, probably, we won't tell. I guess I'll have to share. She's going to be 70 next week. Happy early birthday, Cindy. But she is 70 and she's working in the med spa as my esthetician. She's full of energy. She's running around like the Energizer Bunny. And she just got married in August and she made me put pellets in her husband so he could keep up with her. So let's just leave it at that.
That's awesome.
Well, thank you. Thank you so much, Dr. Wong. And once again, if anyone's interested in some H.R.T. and a person that has vast amount of knowledge and really cares about her patients, please see Dr. Wong at 955 Main Street in Winchester, Mass. Zip code 01890. And she's in Suite 306. You can call her practice. Can you provide your practice number?
Well, it's just my practice name is Caring for All because we care for all, everything. So I think that's probably easier to remember, Caring for All. You can look me up.
All right, Dr. Wong, thank you so much for your time, and I do appreciate, and please give your respect to the patients that stood aside for my lateness today, as always.
Okay.
And then I'm going to finish up with Alan over here because I got to ask him. Some of my friends wanted to ask something, so I wrote it down, and screw you. She hung up. I mean, bye, Dr. Wong. Didn't even say goodbye to us, Alan. Just hung up. So listen, so one of my buddies had asked, which I found pretty interesting. I just got to find what he said. And I think I sent it to you also because it was a pretty intense question. And it was about, I'm sorry, Wes. Okay, why should someone choose Avexitol over other substance they might find on the market? And when I'm discussing market, I'm talking about street, obviously, because such as testosterone, anadrol, Sessinone, or Winstrol. What are the key differences in safely effectiveness in long-term health outcomes? Now, that product isn't the same, right? So that's what I kind of wanted to discuss because some of my guys are always like, well, you know what? I like Sessinone, or, I like Finaplex and this and that. So I kind of wanted to discuss on that term.
Yeah, I mean, I can't get too deep into that world just because I don't know too much about it. What I can tell you is, I mean, you're dealing with synthetic hormones at that point in time, and they really are anabolic steroids. So, I mean, yeah, you're gonna feel great, right? But
His office with podcasts.
I think I got a click to shut off
yeah,
Dr. Wong.
turn her off.
Sorry, I'm leaving. I'm muting myself. Bye. Thank you.
I'll see you later.
But well, yeah, when you get into that world, I mean, that's really around that bodybuilding world, right? You're looking for certain results, right? Super physiological results, and that's really not what we're doing, right? We're taking a medical approach to this. It's not about your gains in the gym and getting up on stage, and there's a place for that for guys that in those rounds that that's great if that's what you want to do, but there's a lot of side effects that can come with that, and you're going to pay the price eventually down the road. You might feel great now, but you're going to start to see, just the way your body handles that, it's going to be problematic, further down the road. So when you look at what we're doing, I mean, we are just taking a bioidentical testosterone, right? And we're really trying to just optimize that patient. So it's not just about that performance in the gym or that recovery. It's really about how do we handle your day-to-day lives. I mean, like I said, we'll get back to the beginning of this. I
Yeah.
mean, brain fog, cognitive function, better sleep, just better.
How about estrogen levels, though?
Estrogen levels.
Can a male have an estrogen issue that happens?
It's possible, and you'll see it with those guys more so because what happens is, and why they block estrogen, which I don't want to get too deep into the medicine on that one, but estrogen does play a really important role in men. It really helps with sexual performance. It's really calming to guys, right? It helps with visceral fat. A lot of people, think about it oppositely, right? So what happens is when you get testosterone, it converts into estradiol. When you're doing it on that level with a synthetic anabolics, you got to realize you're getting your testosterone levels 2, 3, 4 times outside of normal ranges. So you're getting a huge estradiol conversion. When you're doing it with our approach just to optimize you, your body understands how to naturally convert that into estradiol. We don't need to block it. Now, there's certain instances with things that could possibly happen as far as side effects that we may need to a little bit.
Yeah.
But 90% of the time, we're not going to address that if there's no symptoms because there's a lot of protective benefits of it. Estradiol for men and women is bone, breast, brain protective. So we didn't really even address any of those concerns, right? Is we kind of focused on symptoms, but there's long-term protective benefits of all-cause disease and mortality when it comes to these types of therapies.
Yes.
Right? We know that we're cardiac protective, we're bone protective, osteoporosis, Alzheimer's disease, diabetes, things like that. I mean, can really decrease that risk.
And you're talking about years and years of research in this.
Absolutely.
Like it wasn't just something you guys just came up with and said, you know what, we know it does this, but you guys have gone through this, tested it, and how many years was dedicated to this?
Absolutely. I mean, decades. Everything we do truly is evidence-based. We're never going to dose a patient or give a patient any type of hormone without being able to support evidence behind it.
Okay. All right.
Well, I want to get back in just to addressing testosterone. Though,
Absolutely.
Because I mean, typically it's always, kind of dictated as a male hormone, right? When you think about testosterone, it's related to males. Estradiol is related to females. But I mean, that's a big misconception around that because testosterone for females, I mean, it is vitally important. It's actually the most abundant hormone a female body ever makes.
Yeah.
So when Dr. Wong was talking about, those vaginal creams for estradiol and what, medicine has done in the past, historically, testosterone has never been addressed in women. And we're doing a real disservice to those, especially you start to hit the age of 30, women and men alike start to really decline in those levels. And you start to see, I mean, how many women are, on a birth control for certain side effects or symptoms that they're feeling. And then they're on an SSRI for anxiety and depression. That's really their ultimate treatment. Now you got a lot of other issues that's causing other symptoms and side effects and things like that. They don't feel great. They're putting on weight where we can really address their hormones and fix a lot of that without putting them on some kind of medication.
Huh. So I know you're not a doctor or anything, but one of my buddies actually just texted me and I looked down at my phone. How about the effectiveness of being on an H.R.T product or hormone treatment in affecting prostate? Because he has an enlarged prostate. Is that somebody that would be able to do it? And would he benefit from doing it? Would you actually know that?
That's something that, someone like Dr. Wong would really address and see what the medical history is about. Can we treat prostate cancer patients and prostate?
Not cancer. He just has swollen.
Yeah. That was something
that would
be
prostate.
addressed. And they would take a look at that.
Okay.
Dr. Wong is well equipped to be able to handle that. And that's something that we would handle with our medical faculty. So I don't really want to speak to the medicine on that, but there are, I'll just let you know, there are options.
Huh. I had all these things all planned to ask you and you rolled it all in. That's why sometimes I don't like to turn around and give people my questions. So if you're turning around and I'm going in to go see it, what's the like how can Avexapel certified providers and help educate patient about safe hormonal treatments? Because obviously we both know it's obviously I'm way older than you, but I know for a fact my education was from a gym.
Yeah.
I see a big guy, I go over, I'm like, what the hell are you on? And back in the day, they'd open up a gym bag and show you a bunch of products. I'm like, okay.
Yeah.
And you go and you try it out and whatever from there. Now obviously it's almost like marijuana. It's obviously now it's almost illegal that you can go and get something for it. So now I go to a clinic and I do this. So like, how do you educate that patient? Because obviously you said a lot of words today that a lot of people aren't going to understand and simplify it. But how do you educate them that they know when they leave that it's safe and you don't need to worry about it? Because I have friends of mine that have had it done before, not from your treatment, from other ones where they had it in the gluteus maximus placed in there and the pellets have popped out, and they said, oh, don't worry about it, some of them could fall out, but it still gives you the amount, the correct amount. So I believe people are so misinformed about it from certain practices saying one thing, and then now you're going to a place that's educated and let you know if one falls out, what happens. Like I know that's a lot of questions, but can you feed me some of that?
Yeah, no, and I don't think you kind of asked about the differences of why we do and how we do it, and I can really address that in that instance. But I mean, you're right about that. I mean, there's pellet therapy can be done the wrong way, and there's a lot of problems out there. I mean, you don't want to be you put those in subcutaneously, and you start popping out pellets. That's a problem. Nobody wants to deal with those issues. So they were kind of the things that we started to see early on, and why we were able to break off and create Avexius, and really our main goal was patient outcomes and experience, right? We know this is a great form of therapy, but when you start to see the sustainability down the road of that and having those issues, we needed to solve for that quickly. So Dr. Terry and Dan and I, both our founders, and Dan's our CEO, really went on a mission to figure out, hey, how can we make a better pellet out there and really give a better patient experience? How do we get rid of those problematic issues that we're seeing? And they were able to do that. And so we do own our own custom compounding pharmacy. And
really, I didn't know that.
Yeah, and then we own our own 503B FDA certified outsourcing facility.
Wow.
So that is a federally regulated facility that adheres to the same standards and regulations that Big Pharma does. So anything that's going to come out of that pharmacy has to meet quality control standards, right? We got to make sure that we're putting a safe and efficacious product out there, a potent product, and pure. So that's first and foremost right there. And there's plenty of documentation to be able to back that up.
Okay.
But one of the things that we've really been able to do is change the way that pellet was actually formulated. So looking at that inflammation, scar tissue, the extrusion.
That's what I wanted to talk to you.
Out.
Yeah.
So we actually have the only patented pellet that's manufactured out of a 503B outsourcing facility, which we're incredibly proud of. It was tough to get a patent on this, but we truly were able to show uniqueness and safety and efficacy with it. But what we did was we put a little trace amount of an anti-inflammatory that's mixed throughout that pellet.
Yeah.
So as you start to get that little bit of inflammation, we're going to tame that down, help infection rates, get that inflammation down, promote, little to no scar tissue buildup for better long-term. So we're not seeing the extrusions, we're not seeing the infections, we're seeing just better overall outcomes for patients. I mean, when I go back to, that procedure, I mean, like I said, it is, when done the right way, pain-free, bruise-free, less downtime.
I love how you said if it's done the correct way.
And that's like anything. Any
no,
there, right?
No, I understand.
And that's where you got to make sure that you're going to a trained provider that, it knows what they're doing, because there's a lot out there, unfortunately, that, get into this for the wrong reasons, and just don't.
Well, I know specifically, not to cut you off, a friend of mine went to a place that they heard people in. Plain English. There was no care. There was no explanation. There wasn't even a sheet that he was handed in. It was basically like, we did a blood test. This is where it came out to. It wasn't a symptom sheet. So what I liked about your company is first you guys touch base on the groundwork of the individual.
Absolutely.
Then you go into the physiology of blood and everything.
You got to address everything. We're not just throwing hormones at every single patient, right? I mean, it really is an individualized approach.
And you can deny somebody that treatment, correct?
Yeah.
Someone can come in and say, I want it done. Then all of a sudden, no.
Yep.
So one of my questions, and I was just looking at it. So I get a pellet placed in me, correct? What makes that determination on when that pellet breaks down into my system? And does it go by the determination of my levels that go up and down? Like, where does it go? If you were to do an RS1 line or a wave line, like, how does it actually work to your body?
Yeah, so it's really all cardiac output. So the more active you are, the quicker you're going to burn through those pellets.
Really?
So, they right to the bloodstream. Now, on average, your females are going to be about 3 to 4 months. Your guys are going to be like 5.5 months. You're going to have
5.
some amount like me.
So someone that
Yeah,
works out and
yeah,
active, like, like you're
I'm
training
high
out there.
stressor. I'm
Yeah.
running. I'm gunning. I'm like 4.5 months on my
4.5
birth. I birth
months.
her a little quicker, but like I said, you're on average going to be about.
But how do you
5.5
know
months.
that? So if I turn around and I get it done, do I go back in and get it tested, or is
Yeah.
it by my symptoms internally?
It's both. So what it looks like is, one, you're going to get your first set of labs, right, to determine how we're going to dose you and treat you.
Yep.
5 weeks later, you're going to get post labs done, and then
Okay.
another symptom checklist. We want to see where you were baseline, where you're at now, and then have the
So my
correlated
level.
levels to support it, right?
Okay.
And if we got to make any adjustments, we will at that time. After that, towards the end of your cycle, you're going to you'll feel those symptoms come back. Now, one of the things about our pellet is we've really slowed the onset of, those symptoms coming, because the way we created a binder in our pellet. But typically, you'll start to feel those pretty heavily, and within 1 to 2 weeks, you want to get back in there. You forget how bad Dr. Juan talked about it. You forget how bad you feel. You come to the end of that cycle, you'll start to feel. But our goal is to not let them come all the way down, right? Let's get back. We want to have nice sustained levels.
Okay. I love it. I love it. I love everything that's being said. So, but what else some of the common misconception of this about hormone therapy that you've encountered, and how has Avexapel addressed it?
Yeah, I mean, a lot of it goes down to one, we talked about testosterone in women, right? That's a huge misconception, because we really need to address it. It's so important to address that in women, especially as early as the age of 30 and up. But then, when you look at it, especially Dr. Wang talked about the WHI, which was the Women's Health Initiative. So that was a study done back in the early 2000s that was based off of synthetic hormones, and really labeled, as the reports came out, it labeled all hormones as bad.
Absolutely.
Right? They saw an increased cancer risk, increased cardiac risk. And unfortunately, at that time, all providers changed standard of care. A lot of women got off their hormones. And what did we start to see after that? Cardiac events skyrocketed.
Yes.
Right. You start looking at, everyone's worried about breast cancer concerns. And that was really what that study was tied to. But what we don't really, associate with, the number one killer in women, cardiac disease, heart attacks.
Really? I did not know that.
5 times more likely to die from a cardiac event than breast cancer.
Really?
Yeah.
Now, is that worldwide, or is it just one area that you've guys done that research on? Like,
yeah,
it's well.
It is. There's a lot of studies to support that.
I did not know that.
Yeah. So you flash forward to 2017, and the publishers of that study came out and said, "Hey, we got this wrong. It was a very flawed study." Unfortunately, it went mainstream back in the early 2000s. I mean, it was on Time magazine. It was everywhere.
Yeah.
We're finally starting to get away from that. But one of the problems, when you look at standard of care and the way institutionalized medicine is done, we're 13 years behind on data, right? So if we need to change standard of care, it takes 13 years to be able to do that. So going back to 2017, when we looked at this and say, "Hey, we got this wrong," we're only in 2025, right? We got another 5 more years before standard of care could possibly change. Now, it's going that way pretty quickly. One of the great things about this is, I think COVID's been a big proponent of this. Patients are really starting to advocate for their own health. They're starting to see that, hey, what I'm doing is I'm not getting better. The patient population is getting sicker. We're getting fatter. I mean, we're trending in the wrong direction. We do a great job in this country at treating, disease, but we're doing nothing to really prevent it, right? And that's really where this comes into play.
Okay, all right. So one of my other questions is, and I don't know if you recall this, but I remember going to an event, and I swear it was one of your event, where a female doctor was discussing about breast cancer, and how a lady was going to go get a mastectomy done and whatever, and she talked her out of it and said, "Please give us a chance. What's the worst that can happen?" And I want to make sure I recall the story. And she said, "What's the worst that can happen? They're already telling you we gotta cut them off. So give us an opportunity." And from what I recalled, they put a pellet beside where the cancer cells were.
Yep.
And then they came back and they looked at it. Do you recall this story?
Yeah, so this is actually Dr. Rebecca Glazer out of Dayton, Ohio. And you can look, if you search her name, and she has a ton of great articles that talk about this. But yeah, she's actually using testosterone pellets and placing them around breast tumors to significantly reduce the size of the tumor. So all her, she has a bunch of clinical studies. If you go to, I think it's Millennium Wellness is her practice, but it's Rebecca Glazer. Put that into Google. I think like the second one down is going to pop up. She has like 10 different articles of interest, talk about those myths and misconceptions and things like that.
Yeah,
That's
yeah.
all covered, all the protective benefits of cardiac disease, breast cancer, things like that.
Yes.
She goes into all that in detail.
Yeah, because that story to me, the
Yeah,
reason I
that's
paid so much
powerful, right?
attention. Yeah.
Yeah.
My mother is a survivor for breast cancer, and I know the town I'm from. You know, they have a large group of cancer breast patients that have occurred and happened in the year that I've graduated school, and it like saddens me to see this happen. And it seems like it's a continuous thing that's occurring. But now I'm starting to understand that there are other means that possibly can help this, and you know, to me, if I know I'm going to get something cut off and there's another means to not get it cut off,
and
I'm going to try it.
and it's not just that. It's really about, you know, what's their life after cancer, and that's what we really focus on. I mean, when we look at cancer treatments, the whole goal is to kill the cancer cells, right? What's that doing? It's killing every other cell in the body as well, right? So starting whether we're addressing hormones or we're addressing, you know, nutrient deficiencies and things like that, taking this approach can really help that patient after and really rebound and have a better quality of life.
It seems like your product touches bases on everything. Where unlike as you discussed was street anabolics or androgens and things like that.
I do want to make something clear. We are as a company not using testosterone pills to treat cancer. I do want to make.
Oh no! I know. That's why I said I remember going to an event where you had a doctor discussing it. But one of my things that I've noticed is a lot of my associates and old associates, some of them have passed from excessive use of street steroids. Some of them had enlarged hearts. Some of them basically, I'm not a medical doctor, so personally can't tell you. I remember where Lyle Alzada played for the Raiders. And I remember this big prone thing. He came back, he's jacked up, he's playing football again. All of a sudden he has brain cancer. And they automatically said it was steroids. They automatically said it was human growth. But people don't understand that there's two different types of synthetic products in your product. And understanding that what I believe is, once again, I'm not a doctor. Obviously, if I have a cancer cell that's in me and I'm doing human growth hormone, HGH, it's going to make it speed up 10 times as fast. So I wanted to touch base where people will talk to me, well, it causes cancer. Well, my question is, obviously, it's a question you might not be able to answer. Would your product cause cancer?
So all the studies support that it's cancer protective, right? We do have to be careful addressing if patients do have active cancer. We're not going to address hormones in that situation. We want to make sure that they're fully clear in recovery, right? Before we do that. Like I said, all the evidence and data is going to support that. You know, when we're looking at testosterone, estrogen, progesterone, it's all preventative of these types of diseases. Now, can a patient end up getting cancer while they're on these therapies? Absolutely, right? Can we correlate it? Possibly, but you know, correlation isn't causation, right?
Yep.
So,
all right. And one of the biggest questions that a friend of mine had asked, female, she goes, "Well, I don't want to walk around after I do it, and then all of a sudden have to pee standing."
Yeah.
And I was like, at first I didn't get what she was saying, but I understood it, and I was like, all right.
Yeah, women get that. Like I said, women hear testosterone, they're like, I want to get big and bulky, horse voice, grow a bunch of hair, really get a beard. And I mean, it's not what that is. I mean, like I said, going back to testosterone in women, it plays a vital role. Now, women make much less than guys do, but we still need to optimize it.
Absolutely.
You're not going to get that horse voice. You're just going to all those benefits that we talked about. Just by it's a little microdose of testosterone. It's nothing crazy, but like I said, nothing super physiologic. You're still going to be a woman at the end of the day. And guess what? You're going to feel better as a woman, right? You're going to feel more like yourself.
Well, and I'm not going to deny that. I've seen, obviously, you know, Dr. Wong's my wife, but I've seen so many of her friends that and patients and things that are on it. And if I'm telling you, I've seen like 10 to 20 years of attitude fall backwards on them, and how much energy they've gotten, how much they want to apply themselves even more, how they're getting up early. I've actually seen the changes in all of them, because we all did that. And usually it's like 9 o'clock. Everybody's like, I'm going to go home, go to bed. No, these people are raring to keep going. And I'm like, what the hell? Right. And they brag about it. So I definitely see that it's been an upcoming thing. So anything that you would like to say on this?
I just say, hey, if you're out there and listening to any of this, you know, sounds familiar to you, you guys are suffering, men and women alike, go see Dr. Wong. I mean, it is life-changing. The stories that we get to hear, I mean, talking about, you know, I had a provider just call me up last week. She's down in Ocean City, Maryland, but she's out to dinner with her family. And one of her patients walked up to her in the middle of the restaurant, just gave her a big hug, gave her a big hug,
Love
and
it.
thanked her. Like, you saved my marriage. She was on the brink of a divorce. You saved my marriage. You saved my life. I mean, when
Yeah.
you get to hear stories like that, that's powerful.
Absolutely. Absolutely. So first of all, me personally, Felipe, would like to thank Alan so much for showing up.
Brother. I appreciate
Showing
it. Love
up,
being
bro.
out here. Yeah.
And I do apologize for the lateness to everyone. And on top of it, I had a vast amount of questions that I did send to him so we could stay within the grounds. But it seemed like Alan answered it all before I could ask any of them, which I love. And all kidding aside, we're not here to promote people or anything. But obviously, I have a personal vetted thing with Dr. Wong, but I do say that I've been blessed to meet her, and she's been in my life, and she is a very talented doctor, and she takes very high care of her patients. And I'm so happy Avexapel had trusted her to join her team with them. And anything that you guys want questions, I can always ask Alan anything he wants. I have his personal phone number. We can continuously update. We can definitely have other programs to touch base on this. Let me know. But let me just look, because I see some people are on Facebook. So I did say, oh, we have a patient of Dr. Wan, and I tell everyone balance is absolutely key.
Awesome.
So she is one of her patients, and she loves the product. I know that for a fact. Hello, Catherine. Hello, Kevin. I'm not going to say anything about you, Kevin, but maybe you should try some H.R.T. And CC Wright finally got on. Hey, Ray, any questions for Alan before I hang? Ask now. You got 5 seconds. You got 4 seconds. You got 3.
Hit me with it.
If no questions, he can answer anything you want. Go ahead, Ray. I know you've been dying. Ray. All right, give it up. I'm hanging up. Thank you so much, everyone, for joining us. I really appreciate it. Stay tuned for the next show that's happening. We will be back on again at 12:30. Thanks, everyone.
Take care, guys.
Ciao. Well, that was nice, bro.
Awesome, man. That was cool.
Great job. Great job. Nice. Boom and boom.
What do you got going on at 12:30?